So the political determinants of health are the legal drivers that inform the social determinants of health because it's the why. The social determinants of health tell us the what, but my ache is the why. And the political determinants of health really gave me a great foundation as to that why. So those are the legal, those are the political, the policy decisions that are made, that have been made well before us, well before our grandparents. These are hundreds of years old policies that still impact the way in which that our lives are determined and the way we live our lives in 2026. And I feel like that is just so important to understand as a public health champion as well. A great example to me is redlining. Redlining was the governmental practice back in the 30s where they determined black neighborhoods to be poor neighborhoods or like undesirable neighborhoods, while your more affluent white neighborhoods where your prime real estate and those were like valuable communities. And so with those classifications and those characterizations, those they allocated resources to those areas. So the more affluent areas, they got grocery stores, they got swimming pools and recreational areas. They got better schools and better governmental assistance. Meanwhile, your poor areas, they had to fight and scrounge for themselves. The grocery stores are far few in between. Many of them had to commute to other areas to find food. We call those food deserts.
Yeah.
All that. And if you were to look at a map of your city from the a redlining map of your city from the 30s, and look at that same map and kind of trace like food insecurity, socioeconomic status, crime. If you were to trace all of those indicators in 2026, you will usually find that they are identical still, 90 years later. That those same decisions that were made again of no fault of your own, no fault of that community, no fault of not even no fault of the affluent community. It was the decisions made way decades in advance, and you're still feeling those effects. And I feel like that's more so profound to think about. It's a little bit enraging. I've been mad.
Yeah,
I've been mad. The more you get a little upset. But it's just such an eye-opening thing to learn about. That again, we hear the social determinants of health a bunch, but we
yeah.
never hear like why those are a thing.
Exactly, man. We gotta clip this and post it as like a little short reel or something, man. Because that's everyone. A lot of people need to hear that, man.
Sure, for sure.
Because especially in public health, it's easy for people to look at data or anything and blame it on the social determinants of health. Kind of
Hmm.
blame the victim in a sense, when in reality, so much of this is a systemic issue that, like you said, based on choices that none of us were here to even make, man. It all ties
Hmm.
back to the system that a
Yes.
lot of us might be working in. So we got to work towards addressing the political determinants versus just batting the victim over the head. And so
Yeah, for sure. And it was crazy is the people that made those decisions, they probably passed away shortly after they made the decision too. And they weren't even there to see. It's just it's crazy.
yeah, man.
Redline probably I use that as a example for all my classes, all my students, because it's just such a I pull up a map, and you literally can see it. And I again, if you tell me I know it, if you show me I can be it. Like literally, you can see it bar for bar, and each decade it's the same. No improvement, no growth. Every now and again, as neighborhoods and gentrification happens. But yeah, it's a political determinants of health was a big eye opener.
All y'all public health workers better have been listening during that part, man. Y'all had your listening ears on, But
And I feel like it's ever the more relevant, especially now. We live in such a tumultuous social political climate now. It's like, oh my God, and I fear for like the repercussions that we are to face like decades later. Because you usually don't see the effects of a presidency until the next one. And so I don't know what that will look like and how much fixing the country will need, after this one.
but that's why we out here in the
Right.
field getting that work done, trying to represent, man. We
Mr.
gotta.
Scott, we need you. Come on now.
That's what's up. That's why we out here, man. That's what we're doing this all for our
Yes, sir.
people.